So we're going to look at the ankle today. With Jen, we're going to look at the active, passive and resisted tests of the ankle joint. We're going to start with active movements. Jen, are you okay to move your ankle and work today? That's great. First thing we're going to ask Jen to do, we're going to ask Jen to move both, because we're looking at active, we're comparing sides. Obviously we do that with the whole thing, but especially with active. So Jen, can you bring your toes up towards you as far as you can? And again, looking for symmetry, are they moving the same? Now can you point them away as far as you can? Thank you very much. Right, so that was dorsiflexion, plantar flexion. Now we're going to look at inversion and eversion. Okay, that's it. So inversion, if you bring your feet in, and if you bring your feet the other way, that's eversion. So the in is inversion, and that currently is eversion. Yeah, thank you for that. Now we're going to do some passive movements. I'll just do one side, just for demonstration purposes, but of course you'd compare the sides. Okay, Jenny, you alright? Put my hands on, yeah? So I'm just going to bring your foot up as far as you can, and I'm just going to over press. Make sure that you, again, we're focusing on the ankle joint there. We're not too high up and pushing the toes. We're down here and just relax it, and you're coming up and feeling the end there. Okay, and again, plantar flexion now. Point your toes away, and then again I'm just going to over press, or you can over press like this. Again, making sure you're not down on the toes. You're appropriate, you're below the ankle, you're supporting, and you're giving that over pressure, and that's plantar flexion. Okay, for inversion, again we're not down here, quite close, and we're bringing the ankle in. Okay, so we're moving in and feeling that end pressure. Then eversion, coming out. Okay, so it's out. Okay, so that was inversion, eversion, passive. All right there? So we're going to move on to ankle resisted tests now. Again, supporting the foot, you do both sides obviously. I'm just going to focus on one side. Can you bring your foot up there? Keep it there for me. Don't let me pull it down. And relax. So that's resisted dorsiflexion. Again, make sure you're supporting the ankle so the patient's nice and comfortable. Make sure that you're below the ankle, but not too far below, that you're involving the toes, and that you're supporting. So over the metatarsals, okay, quite proximally. And then we're going to do resisted plantar flexion. Again, so coming in, and Jen, if you just push down against me. Okay, so again, underneath, you can use your hands, but you should both, and just pushing down. All right?
Yeah.
So that's plantar flexion. Inversion. So again, Jen's going to want to do that movement. I'm going to stop her by applying a resistance force, and Jen's going to come in for me. Excellent. Eversion, out that way. Swap hands. Add the resistance side, and ask Jen to come out against your hand, and you're resisting. Relax. Thanks. Yeah. Okay, so there we covered ankle movements, active, passive and resisted tests. The movements we looked at were dorsiflexion, plantar flexion, inversion and eversion.